Dr. Kahng, talk a little bit about children dentistry. I know you're a family dentist and you do children. What recommendation would you have to a mom who just had her first baby and, maybe not her first, but anyway, most likely because if people had a couple, 2, 3 babies, they probably learned a lot of it one way or the other way already. But what suggestions do you have? When should they go to a dentist first? Why? And what should they do before and after the child has their teeth? Or what shouldn't they do? Mistakes they make. Can you kind of enlighten us a little bit on that whole thing?
Okay. When the parents, they have a new baby, and they're very excited. And also when they see the new baby teeth coming in, wow, they're very happy about it.
Almost like the baby walking, huh?
That's right. But the first thing you have to know about that is the baby teeth has to be saved until the permanent tooth coming in. And to keep the baby teeth healthy, the most important part is the good habit. When the baby is young, sooner is better. Start clean the teeth. At the baby teeth, when the babies are very young, so they don't take care of their teeth by themselves. So parents must help them first. So use the soft gauze and then wet the gauze with the water, and you can just wipe the tooth after the baby drinks the milk. So it can help the baby teeth healthy. And younger age, the cavities is the most common problem with the baby teeth. And those cavities can be prevented with the fluoride. And also certain age, they grow up a little more, then they can start to use the dental floss. But the dental floss, the young children, they cannot use by themselves. So at the young age, the parents, they can help use the dental floss. Also, they can help them with a toothbrush. So preventing is the most important part for the dentistry. So prevent the cavities with the fluoride, proper brushing and the flossing. They can maintain the good health teeth until they get the new permanent teeth.
And I assume that the parent should kind of, be it at the beginning with a towel, as you mentioned, and then with a toothbrush. The parent should first do it for the child till the child gets used to it, and then observe and makes the motion him or herself correctly. But first, the parent should constantly do it. Yes or no?
That's right. The parents, they have to guide the children for the proper brushing and the flossing. And when the tooth start coming in, then they have to bring them to the dentist and then start the routine dental checkup.
That was my next question. So when should people bring their kids to a dentist? You say when the first teeth starting coming out. Yes?
That's right.
Now, I assume, I may be wrong, but I assume that there's not much dental work to do. What are you doing there in such a visit? What's the purpose of coming to you then and there?
That age, you can teach the parents how to take care of the children's teeth. Also, amazingly, so many times the very young age of the children, they already getting the cavities because they didn't clean properly. So those have to be checked, and we have to prevent cavities.
I see. Okay, so you need to do that, and probably it also gets the child used to. Probably you want to see the child and just count the teeth, do whatever you do, so that the first time the child goes to a dentist, it doesn't see that drill and gets all scared. Kind of, so it gets more gently used to a dentist, right? That's
primary purpose of going to a dentist at a young age.
Now tell me about the bottle syndrome I hear about. What is that?
Okay, and when the babies, they cannot eat, so they drinking the milk. The milk has a lot of sugar inside, and when they drinking the milk with a milk bottle, and they don't brush the teeth, then the cavity start on the teeth. Same like after eat the candy, you don't brush the teeth, it can cause the cavity. Same thing. After drink the milk, just don't brush and holding the milk all night long, and then it causes the cavity so very tremendously. So when the baby they using the bottled milk, always making sure they have to clean the teeth, and then they can hold the bottled milk all night long. It can cause the cavity too much.
Yeah, well, of course that makes sense. So basically if you have milk, or for that much anything else, or orange juice or whatever it may be, if the kid has it in a bottle and sucks all night on it, then all the teeth are soaked in the milk. And the milk turns acid, it turns sugary, it is sugar, and so the whole, it basically not only do you not brush your teeth afterwards so that everything comes off, but you're literally soaking them in it, so you really ruin them very fast, right?
That's right.
But what do you do when a baby, so to say, wants that bottle? Can you just fill it with water or something like that, and have it sucking on and falling asleep?
When the baby, then when they go to sleep, we suggest they shouldn't hold the bottled milk. They can maybe have the water in the bottle. They can use that, so can prevent the cavities.
Good. All right. Well, wonderful. And what about, baby teeth? How important is it to take care of baby teeth as they, a 4-year-old has all the teeth in it, and all of a sudden the kid has a little toothache cavity, and fixing a cavity obviously is more money than pulling it. Just like down the road, it's more money to fix it with a root canal and etc. You should be, because I know when I was young, and it was like my father literally pulled teeth at home, literally with the string and swapping the door. I'm not kidding. I don't know whether but we did that, and there was no going to a dentist, and the tooth just came out because it comes out eventually anyway. Was the consensus. And it gets replaced by a real tooth, a long-lasting, forever, permanent tooth in a year or two anyway, so why bother fixing it? That was the consensus. What's your take on that?
Underneath the baby teeth, the permanent tooth is ready to come out. If you lose the baby tooth, then the space can be closed and the permanent tooth cannot come out properly. So later it can cause some wrong alignment of the teeth. So baby tooth has to be kept in place and the health condition. So when the cavity starts, fix the cavity so baby tooth can be saved until the permanent tooth coming in.
I see. So basically, you should maintain them as long as possible, as long as the dentist thinks it's needed, before he then says this one needs to go to make space for the other one or whatever it might be.
That's right.
Okay. Well, all right. All right. Thank you very much.
Thank you.